almost every single one of these pillars is affected by menopause. Maybe not financial as directly, but it could be, maybe indirectly. Next slide, please.
Bad. And I'm just going to mention too that I did start the recording.
Okay.
But if we get to the point where we've got questions online or questions here that are more personal, I'm going to stop the recording.
Okay.
So if you hold a personal question till the end, you can make sure it doesn't get captured in the recording. Okay. I'm also just going to shut this door. Sorry.
Yeah, and that's another thing. Please feel free to ask questions, or if you feel comfortable sharing either personal experience or experience of friends and family that you've heard, this can be a discussion. I just don't want to shout information at you. So please, I hope this can be a safe place to ask questions and provide information. So menopause affects anyone who has menstrual periods. So for those assigned female at birth, you're born with all your eggs. And, once you go through puberty and you get that first menstrual period, you have ovulation, releasing that egg once a month, until you get into this stage of menopause. And so menopause starts because you've diminished the amount of eggs that you have. You were born with them, and then after so many years, you only have so many left. And this causes a decrease in estrogen and progesterone. And that's what actually causes a lot of these symptoms that are experienced through menopause. The average age of menopause is about 51. And so the transitional phase into menopause is perimenopause, and we're going to talk a little bit about the different stages. Premature menopause, so that's when menopause occurs before the age of 40. And we'll talk about some of the concerns with premature menopause. The other reason that menopause can happen, natural menopause, that's kind of the end of the reproductive years of life. But the other reasons it could happen is called either surgical, medical, or induced menopause, depending on the specific reason. And that can be a variety of different things, but it's usually either the damage to one or to both of the ovaries, or they're removed, due to a medical procedure or something like that. And this can also happen, for example, with chemo and radiation to that area that can cause damage to that area of the body and cause the induced or surgical medical menopause. Okay, and so we're going to go on to the stages, symptoms, and treatment. So I briefly mentioned perimenopause. This is the start of menopause, where that number of mature eggs really diminishes, the estrogen and progesterone go down, and that causes irregular periods. You get the ovulation that doesn't happen every month. And so the symptoms that I think people mostly associate with menopause actually start with perimenopause. And perimenopause can start years before actual menopause begins. During perimenopause, you're still experiencing menstrual cycles, but it's definitely irregular. The average age is about the mid-40s, and symptoms can last for quite a long time, 4 to 8 years, so pretty big range. Then menopause is 12 consecutive months without a period. So it's a bit interesting because you don't know you're actually in menopause until that 12 months. And then you're like, oh, I was in menopause for those 12 months, but 12 consecutive months without a period. And the average age is 51. And then postmenopause, so that's anything greater than 1 year. Anything outside of that 12-month range without a period is postmenopause. And some people really experience relief from those symptoms that were experienced during perimenopause and menopause. Sometimes they can't continue for several years. And we're going to talk about some of the health risks with that decreased estrogen. But postmenopause, that's really because the estrogen, is much lower. That's when these health risks really do come into concern. Okay, moving on to the symptoms. And looking at this, it looks really overwhelming. I listed as many as I could find. It's a lot, it's very overwhelming, but I just want to mention that symptoms is really individualized. So these are symptoms that could possibly happen. And some people have really, really minor symptoms, and some people have much more intense symptoms. So hopefully we're on the mild or more moderate area, but there are lots of symptoms. The most common is that irregular menstrual cycle that we talked about, because of the decreased estrogen, the decreased number of eggs. And so that's why you're going to have the irregular cycles. There can be worsening of PMS symptoms. So bloating, cramping, some people get headaches or migraines with their, as some of their PMS symptoms. So once again, that's pretty individualized, but it can worsen. Hot flashes, I think that's the most common symptoms that people associate with menopause. And that's probably because 75% of people that go through menopause will experience hot flashes. So very, very common. Vaginal dryness, so that can cause pain with intercourse or discomfort. There's relaxation of the pelvic muscles, which can cause frequent urination. Hair loss or thinning. And then there's also could be hair growth in maybe places like on the face or places you didn't have hair before. Dry skin, eyes and or mouth, breast tenderness, cardiac effects. So that might be heart palpitations or, that racing heart feeling. Emotional changes. So that could be irritability, anxiety, stress, mood swings, depression. Difficulty sleeping is another symptom. Changes in libido or sex drive, weight gain, headaches, joint muscle aches and pains, difficulty concentrating or memory lapses, night sweats. So these symptoms can last for years. And these symptoms can also have a big effect on daily life, relationships, work. So I know this can be overwhelming, but I also want to talk about, or we will be talking about, some of the good parts of menopause, and yes, I did say good, there are good things about menopause. So I just, sometimes going through these pieces that might feel a bit overwhelming or depressing, we all talk about some of the good things and things we can do to improve these symptoms. So hopefully just keep that in mind as we go through more of the unpleasant symptoms. And first, bone loss. So bone loss happens, it's a natural part of aging. So actually bone loss can start happening at the age of 30. But when we have that decrease of estrogen, we're more prone to more aggressive bone loss. So that decrease in estrogen with menopause causes the bones to deteriorate faster than they can grow and strengthen. And so then that raises the risk for fractures, osteopenia, and osteoporosis. And you can see from the image on the right, there's just the differences. This is an image from the National Institute on Aging. You might be familiar with this image, but we can see that the osteoporosis bone has a lot more space in between. And then also the edge gets thinner. So you're more prone to breaks and falls, or not falls, but fractures. And an interesting stat is as much as 20% of bone loss can occur during that first 5 years of menopause. So that's quite a lot. And so that's why I wanted to focus on it. And we are going to be talking about some of the healthy habits that we can do to help hopefully prevent the bone loss. Maybe not completely, but hopefully make it not as extreme. And then also, so sorry, keep ending and then going. There's not really a symptom for osteoporosis until you break a bone. So, we're going to, like I said, we're going to talk about some of those healthy factors to hopefully prevent osteoporosis.
I think, Veronica, and
Yeah.
there's certain tests I think you can have done that will test your bone density. And so I think that's also kind of helpful to know how it's going.
Yeah, and I can't remember if that's called DEXA, or I know there is a bone density. DEXA scan. Yeah.
Okay.
And yeah, I think, I'm not sure regarding coverage, but I think you can ask your doctor, or sometimes if you have additional risks, besides menopause, you might have other conditions that might make your doctor more concerned about osteoporosis. And so they might order one of those things, or maybe they're proactive about ordering that just to see how things are. But there are scans to kind of really see how things are going.
I did one of the Lifeline things that you can get separate from your doctor's office. The Lifeline organization, I think they do a test.
Oh, that's good.
Yeah.
Yeah. yeah, really interesting. There is, talking with your doctor, if you do have other risk factors, there might be additional treatments that your doctor might prescribe if they're concerned with bone loss. Okay, done with this one. And then moving on to the cardiovascular changes. So also with that decrease in estrogen, there's a chance of increased blood pressure, increased abdominal fat, changes in your lipid profile. So an decrease in your HDL, which is known as your good cholesterol. And so a decrease in HDL, an increase in LDL cholesterol, which is the not so great cholesterol, kind of considered the bad cholesterol. And then triglycerides can also increase. Your arteries are also more susceptible to plaque buildup. So those things can increase your cardiovascular risk and risk for heart disease. So maybe menopause directly doesn't, but because of the other things that happen with the decrease in estrogen, that can increase your risk for cardiovascular risk. And so then we're going to talk about making sure we prevent heart disease, or things that we can help to decrease our risk. Quit smoking, regular physical activity, a healthy diet, maintaining a healthy weight, and then keeping our blood pressure, our blood glucose, and then our cholesterol levels under control. And those are things your doctor can order to monitor and help, can monitor and see how those progress. Okay, and then so we're going to talk about some of the medical interventions. First is hormone replacement therapy, also known as HRT. And this is replacing that estrogen and progesterone that the body is no longer making. And so this really eases up symptoms, the symptoms of menopause. And so they also can have different risks depending on your age. So that's why it's really important to talk to your doctor about if HRT is an appropriate treatment for you. Then there's also non-hormone therapy. And so that's treating the symptoms. So, difficulty sleep, or the hot flashes, or decreased libido, your doctor might prescribe something that helps with those symptoms. So those are kind of the differences between HRT and then having non-hormone therapy. And then, of course, you don't have to do medical interventions. And so that actually leads us to talking about the lifestyle changes on the next slide. Okay. So we talked about the risks of developing, osteoporosis and cardiovascular disease, but there's also concerns with insulin resistance and type 2 diabetes because of the, possibly the weight gain and the increase in blood pressure. Those things that I mentioned can also increase your risk for type 2 diabetes. So lifestyle management can really help with those things, starting with nutrition. So a healthy diet can prevent some of those chronic diseases, and it also can help with managing symptoms. So first, we're going to talk about having a balanced diet. And so I really like this image from the CDC. It's like the balanced healthy plate. And so if you have a 9-inch dinner plate, that's kind of the average dinner plate size. We want to fill half of our plate with non-starchy vegetables. So asparagus, artichoke, zucchini, salad greens, beets. I'm sure I'm missing tons, but focusing on broccoli, focusing on non-starchy vegetables. A fourth of the plate is protein foods. And protein is actually really important because when we have that decrease in estrogen, it increases our chance for losing our lean body mass, which is our muscle mass. So it's really important to get adequate protein with each meal and snack to hopefully limit that loss of muscle. So protein foods: fish, chicken, red meat, eggs, tempeh, tofu, just some examples of protein foods to fill in that quarter section of the plate. And then that final fourth is carbohydrate foods. And we want to focus on complex carbohydrates for a couple of reasons, and that's to help with glucose control. So we talked about the concerns of insulin resistance and type 2 diabetes. So complex carbohydrates have fiber. And so fiber really helps. There's tons of benefits to fiber. It helps, it keeps us fuller for longer, but it also helps reduce that blood sugar spike that you have if you have simple sugars, candy and donuts and things like that, lots of white breads, that can cause an increase in our blood sugar, kind of more of a curve. And so with having complex carbohydrates, it's a bit more steady of that release of glucose when it's breaking down the food. And so it's not as much of a spike as simple carbohydrates. So complex carbohydrates are things like whole grains, whole grain rice, whole wheat bread, fruits, whole grain pasta. Let's see, I know I'm probably missing a couple starchy vegetables. So that would be like peas, corn, potato. Those are also complex carbohydrates. Let's see if I miss anything else. And then on the side, of course, having water or milk, or hopefully, some sort of unsweetened beverage if you are concerned about blood sugars. And then it's important to mention that your meal might not look like this. It might not even be on a plate. It might be in a bowl or something different, having a soup. It's important to just make sure if you're wanting to have a balanced, healthy diet, that you're just incorporating these different types of food into your meal. Like a soup is not going to look like that, but having the vegetables in your soup, like zucchini, or having the protein, maybe you like to have chicken in your soup, and having carbohydrate foods, maybe you like to have potato or whole wheat pasta, making sure we have those parts. And then what this picture also does not show is fat, and fat is really important. It's one of the macronutrients that we need to have in our diet. And we want to focus on unsaturated fats. And so examples of unsaturated fats like olive oil, canola oil, avocados, peanuts, peanut oil, sunflower seeds, tons of seeds, so soybeans, tofu, flaxseed. So when putting together our meal, this might be when we roast our vegetables, making sure they have the olive oil, or having salmon for our protein food, getting those omega-3 fatty acids. There's a couple of different ways we can incorporate fat, but I wanted to mention that because it's not labeled here on that image, but it's very important. And then speaking of omega-3 fatty acids, a higher omega-3 fatty acid levels are associated with better health post-menopause. So omega-3 fatty acids have so many benefits in general. They ease inflammation. They're really great for your heart, but there's also that added benefit of post-menopause. They have those benefits, or they found that people have a better health post-menopause. And so sources of omega-3s include fish, walnuts, chia seeds, flax seeds, and hemp seeds. And then a few more things just about having a balanced diet. A few studies have found that women who ate more whole grains, fruits and vegetables, and unprocessed foods had less severe menopausal symptoms. So there's just so many benefits to trying to focus on a healthy diet. And then moving on to vitamin D and calcium to reduce bone loss. We did talk about the concerns of osteoporosis and osteopenia. So I think we're all quite familiar with calcium to help build strong bones. But calcium needs vitamin D to help support those bones. So that's why we really also want to get vitamin D in addition to calcium. So sources of vitamin D, sun exposure, fatty fish, cow's milk, fortified cow's milk, fortified plant milks, fortified cereal, whole eggs, cheese, and then mushrooms, fortified mushrooms as well. And then just talking about sun exposure, there's a lot of different factors that go into vitamin D synthesis from the sun. We wear sunscreen, there's different amounts of UV light. And there's just the concern of skin cancer. And so we really want to focus on getting our vitamin D from actual food sources instead of relying on sun exposure, because we want to make sure we're safe in the sun, we're wearing sunscreen and protecting ourselves, which will impact vitamin D synthesis. And then you can also talk to your doctor about getting your vitamin D level checked. In the Pacific Northwest, we tend to have lower vitamin D. So that's, if your doctor thinks, is agreeable to checking that, that's great. And then they could talk about supplementation if that is a concern, if it does come back low. And then little bit about reducing symptoms. Alcohol, caffeine, and spicy foods can be a trigger for hot flashes. This is really individualized. So if you enjoy spicy foods and you have not found that spicy foods trigger your hot flashes, continue to enjoy spicy foods. With alcohol and caffeine, those just have multiple effects. We'll talk about their effects on sleep. And then alcohol in particular, if you consume more than the moderate drinking recommendation, it can increase your risk for some of those other cardiovascular conditions that we talked about. So let's see, the National Institute on Alcohol Abuse and Alcoholism defines moderate or low risk consumption for women as no more than 7 drinks per week and no more than 3 drinks on any single day for women. So that's just something to keep in mind. Maybe it doesn't trigger your hot flashes, but we want to be mindful of our consumption with all the concerns of menopause. Okay, next one. That was a big one. Exercising. So I think we're all likely, oh, that's okay. Thank you for coming.
Yeah, thank you.
I think we're all likely aware of the many benefits of regular physical activity. It reduces risk of disease, it strengthens our muscles and bones, it's important to our heart and our brain, reduces risk of anxiety and depression. And that's still true with menopause and postmenopause. And I did provide some specific kind of like recommendations if you are concerned about osteoporosis. Weight-bearing exercise 3 to 4 times a week can help prevent osteoporosis. So that might be walking or jogging, racket sports like pickleball and tennis, dancing, elliptical. And then also having strength and balance exercises might help avoid falls. So that includes stretching and yoga, Tai Chi, lifting weights. And then a little added bonus is those 3 are also weight-bearing exercises. So things to keep in mind if you're concerned about osteoporosis. And then an interesting fact is regular exercise may reduce hot flashes, which for me seems a little almost like the opposite, because when you exercise, you increase your body temperature, you're exerting. I would almost think it would more trigger a hot flash. But they found that people that are more sedentary have more hot flashes. So exercising, if you are concerned about having a hot flash, or maybe it does trigger hot flashes for you, is considering exercising in a cooler environment, making sure you're wearing really, really breathable clothing or layers. So if you do get hot, you can, take off those layers to help cool down. And then of course, I just want to mention everyone should talk to their doctor about starting a new exercise regimen. Okay, optimizing sleep. So one of the symptoms we mentioned was difficulty sleeping. And so challenges with sleep can start during perimenopause and continue throughout the menopause transition. And so here are some tips to hopefully get a better night's sleep. First is combating the sleep stealers. So caffeine, nicotine, and alcohol. So caffeine is a stimulant, and I'm sure majority of us enjoy having caffeine in the morning to help us wake up. But it's really important to be mindful of the time of day you're having caffeine. People have different sensitivities. For some people, they might feel like they could fall asleep again in just a matter of hours. And some people, the effects of caffeine may take 10 hours to get out of their system. And so I'm not sure if any of you have heard of the sleep expert, Matt Walker, but he recommends, if you don't want it to impact your sleep, he really recommends not having caffeine 10 hours before bedtime. So if you're finding difficulty sleeping is a challenge for you, that might be something to try. Similarly, nicotine is a stimulant. So for some people, they think having a cigarette or vaping before bed might relax them and help sleep. but it actually makes it harder to fall asleep and harder to stay asleep. So another reason to avoid smoking, tobacco can actually might cause an increase in hot flashes and then also worsen symptoms and cause early menopause. So just, there's so many benefits to not smoking in general. So that just kind of adds to it. So yeah, avoiding smoking, nicotine, and tobacco altogether, but ideally 2 hours before bedtime if you're concerned with sleep. And then on the other side is alcohol. Alcohol is a depressant. So people think it might make them feel sleepier, but it's really misunderstood because it's not a sleep aid. It's really detrimental for sleep. And so it is a sedative. So it makes us feel sleepier, but it actually really disrupts our REM sleep. So the quality of sleep you get when you have alcohol close to bedtime is really, really poor quality. And so that's why when you wake up after having drinks, the night before, you feel tired and not well restored. It's because the alcohol really messes with the type of quality of sleep you get. So yeah, definitely we don't want to drink too close to bedtime or having a nightcap because that will steal your sleep. And then having just some tips for creating an ideal sleep environment, sticking to a routine, lowering the temperature. So they found that a temperature of like 60 to 67 degrees is actually like the most recommended temperature for sleep. And a cooler temperature might help with those hot flashes. And so why that is because, humans were designed to sleep at night. And so that temperature drop after the sun goes down is like our cue to fall asleep. So that's why it's another reason to try to keep the temperature lower in your sleeping environment. And next is darkness. So now we have so many artificial light coming in, whether it's from screens or lamps. That artificial light or light in general prevents melatonin from being released, and melatonin really helps with sleep. So, ideally 30 minutes before bedtime, trying to really have it be dark, and this includes electronics. So if you're used to like e-readers, if that's your preference for reading, usually they have different, like Kindles have different settings to try and reduce that. The blue light, they have different settings to hopefully be really conducive to sleep. Let's see. Then sound exposure. So trying to keep your sleep environment as quiet and peaceful as possible. Maybe that's using white noise or a fan to kind of help drown out some of those distracting noises. And a fan actually is a really great option because it will keep you cool with hot flashes and then also provide that white noise. So a fan is something you can think of. And then also just get comfortable. So if you experience hot flashes at night, maybe consider what you're wearing. Maybe layers would be a good option. Wearing 100% cotton because cotton's really breathable and can hopefully keep you as cool as you can be at night. And then a few specifics about lifestyle habits when it comes to sleep. The first is movement. So sleep and physical activity have a bidirectional relationship. So exercise is really great for sleep, and then sleep is also really great for physical activity. So exercise increases total sleep time in deep sleep, and then decreases the amount of time to fall asleep. So if you're having trouble sleeping, maybe trying to incorporate some more exercise. And then lastly is mindset. So mindfulness and meditation really create a more relaxed state of mind that's conducive to sleeping. They've also found that meditation has improvements in slow wave sleep, REM sleep. And then there's also fewer awakenings in people who meditate. But some people find that meditation is really challenging and it's not their thing, which I totally understand. So maybe trying to find some other things that can help. Deep breathing or yoga. Those are some other options to kind of help bring down that cortisol and still get some of those benefits of mindfulness or meditation. Okay, moving on to the next slide. Managing stress and mood. So menopause is a huge transition, and I think it can be common to feel overwhelmed with the changes the body is experiencing. On top of that, the hormonal changes, that drop in estrogen and progesterone, can trigger mood swings and irritability. And these hormones, estrogen and progesterone, also influence serotonin, which is like a feel-good chemical in our brain. So the decrease in serotonin can play a role in depression and anxiety. And then also I think at the time of menopause, there can be a lot of other life changes happening that can add added stress on top of everything else. Maybe there's pressures at work, or parents are aging and there's changes in their health. There might be changes in your health as well. Kids might be leaving home. Just a lot is going on. And I think it's important to make sure you receive the support you need for your mental health. And so I've listed some things that, can definitely help, but I also just want to highlight reaching out to your medical practitioner or a mental health practitioner to make sure you really receive that individual support that you might need. But also we talked about exercising, following a healthy diet, optimizing sleep, connecting with friends and family. And I think that one's important to point out. I think the symptoms and side effects of menopause could maybe cause some changes in relationship and even possibly social anxiety. And, it's half the population goes through menopause. It's inevitable. And hopefully reaching out, if you have a trusted friend or friend group, making sure you're reaching out to people who you feel comfortable and that you trust, but trying to open up if you feel comfortable. And maybe talking through some of these changes, because I'm sure you'll find that your friends, who are in similar ages to you might also be experiencing the same thing. And there's also support groups for menopause. I'll share one towards the end. But I think it's important to connect with others who are also experiencing this, and they might have tips and tricks that have worked for them that might help you as well. Moving to the positives of menopause. So there might be additional positives of menopause. So if you have other positives, please share them. But these are probably the top 5. And I just also want to remind you that perimenopause and menopause are stages, and it will pass. There might be challenges with menopause, but there are some positives that I want to shed light on. So first is the end of menstrual period. So once you get that first menstrual period, you are on like that continuous cycle up until menopause. It might pause during pregnancy or postpartum, but you're always on that cycle. And as I mentioned during perimenopause, that your cycle can get irregular, so that might be really frustrating. But once you've hit that 12 months of no period, then you won't be on that cycle anymore. And so that can be just like freeing. You don't have to worry about, having all the supplies with you, and what if you leak, all those things that come with getting your period. Also kind of going along with your period ending is that end of PMS symptoms. And PMS symptoms are really common, and 90% of women experience PMS symptoms. So, and those can, for some people, be really debilitating, sometimes getting migraines or, having horrible cramps, the fatigue, the bloating. So even those symptoms, PMS symptoms, can worsen during perimenopause. Post-menopause, you're not on that continuous cycle of symptoms. And so, that might be a game changer for some people. Third, uterine fibroids shrink, and then the symptoms along with uterine fibroids also decrease. And so those symptoms include heavy bleeding, pelvic pressure, and back pain. And sometimes surgery can be recommended for fibroids. And so that's, very intensive process. And so some people, once they don't have their period anymore and they feel a relief from those symptoms, it can be a huge thing. Especially if you're having to go through surgeries to get those removed. And then fourth is no more risk of pregnancy. So that can be really freeing. I do have to mention that even though you can't get pregnant, there's still the risk of getting sexually transmitted infections and diseases. So it's important just to say that, but you cannot get pregnant anymore. 5, this one's probably more personal and individualized and might be more of like an outlook on menopause, but possibly a new sense of empowerment. In the post-menopause stage, women have more life experience. They might be more comfortable going after what they want and what makes them happy. And they might even have more time too to do the things that really make them happy. So maybe seeing menopause as a stage to more focus on yourself and do what you love. Focus on yourselves. Okay. Moving on to some of the benefits and additional resources to help with some of these more challenging times of menopause. MODA's Behavioral Health 360 program. I actually brought some flyers for this program, especially with it being Mental Health Awareness Month in May, and also the potential changes in mood during menopause. I wanted to highlight this program. So the BH360 program is available to MODA members when seeking mental health support. And there's 2 options. You can talk to a behavioral health champion, which is a MODA employee, and they can help really find the care that you're looking for in either a mental health provider. They can look at the other MODA benefits and see what might work best for you. They are with you every step of the way. I know for me, after the pandemic, it was really challenging to find a mental health provider. And so that's why the behavioral health champions are there to really help do the digging and find someone for you, and also making sure it's the right fit for you and you're receiving what you're looking for. So you can contact a behavioral health champion by, you can call the number or access or email. You can also access them in your MODA dashboard. Besides the behavioral health champion, there's also an assessment you can take. So if you're kind of someone who wants to maybe look at things on your own and don't want the assistance of someone, there's a self-assessment. And so you answer some questions and then it recommends some of the MODA benefits that might help with some of the things found in that assessment. And so to get started with that, you can log into your MODA 360 member dashboard, or you can download the app on your phone. And then Spring Health. Spring Health makes it really easy to find high quality mental health care. And so that includes care navigation, therapy, coaching, self-guided exercises. But I also want to really describe the differences between the BH360 program and Spring Health. So Spring Health is a vendor that MODA uses, and it's telehealth. So finding a therapist that's, you can access via the phone or the computer. Whereas the behavioral health champions, if you're looking for someone more in person, they can help find someone more local, if that's what you're looking for. But Spring Health, there's lots of benefits to Spring Health. They usually have an average of like 2-day turnaround time. So it's really fast. They have a licensed care navigator that can help guide and support you. Spring Health is available to members and dependents starting at the age of 6 years old. And there's 30 different languages. So that's a really great part about Spring Health. They also have provider representation from the BIPOC community. LGBTQ plus communities are also highly represented in the therapists. And then there's also after-hour appointments, which makes, if you work during the day, that makes things much easier. And then we have Meru Health. And so this is also to support mental health, but it's a program. So it's a 12-week evidence-based program. There is a therapist that you can text with, but it's mostly kind of texting with your therapist and they're checking in. How's the program going? So that's different than the other 2 options that I talked about, where that's more access to therapy. So Meru Health, it offers confidential access to a therapist. There's also peer support. And then the program provides mindfulness and behavioral techniques for sleep, nutrition, and more. We kind of talked about the benefits of or how sleep and nutrition and exercise can impact mental health. And so Meru Health is available to MODA Health members 18 years and older. And you can access that through your member dashboard, or hopefully Karen can share these slides with you and you can actually click these links that are on the slides.
We had an employee recently who
Yeah. We've heard really great. My coworker used it and she loved it. So yeah, it's different because it is a program, and sort of seeking like a therapist, but yeah, really great feedback. And so it's so nice to hear that helped that employee. So I mentioned how smoking can intensify menopause symptoms such as hot flashes and difficulty sleeping. It can also increase our risk for cardiovascular disease. So I wanted to mention MODA's tobacco cessation program, which is called Quit for Life. So with Quit for Life, you have access to an online community for support. You receive a personalized quit guide with also access to a quit coach who is specific to tobacco cessation. And then you also received like a personal quit plan. I might have mentioned that on the mobile app. So that's called Quit for Life for tobacco cessation. Then we have Sirius MD, and this is a text-based virtual care app. And so MODA members can connect with doctors in less than a minute. And it's available 24/7 without an appointment or any time limits. It's a free visit for the MODA member, so there's no cost copay or cost share. And Sirius MD includes multi-specialty doctors who cover a high range of needs, low acuity all the way to high acuity, and also at really great quality. So you might reach out to a Sirius MD doctor. Might be really helpful if you're traveling and you're away from your primary care provider. You can text using Sirius MD and get that, the help you need. They can also prescribe medications, or if you have questions about your medications, you can also chat with the doctor. So really, really helpful. Then we have Active and Fit Direct, and this provides discounted gym memberships. So it includes standard and premium fitness memberships, and then also access to on-demand workouts through Active and Fit's website. So for the standard network, it costs $28 a month for that standard gym membership instead of the original price of the gym membership. And I actually looked for the in-network gyms in this area that are on the standard network, and some of them, not all of them, but that includes, let's see, it looks like Snap Fitness locations, Planet Fitness, Fitness 1440. So those are some of the locations that are in network with Active and Fit Direct. There's an initial enrollment fee of $84. And so that's the enrollment fee, and then also covers the first 2 months. And then there's a premium gym option. So that includes kind of higher end fitness boutiques or more specialized studios and things like that. And in this area, it looks like Orange Theory, Stretch Lab, Pure Barre, among others, are in Active and Fit's network for the premium gyms. And that's also at a higher membership price than the $28 a month. I think it's more individualized depending on the gym, what that monthly cost is. And so with Active and Fit Direct, you can get free guest passes to try before committing. You can also change gyms at any time after that initial 2-month commitment. And you can access Active and Fit Direct from your member dashboard. So.
And I'll just say we've been seeing more people doing the Active and Fit Direct program and using their employee wellness allowance to help cover that cost.
Oh, really cool.
So we have a program where employees can get reimbursed for some of these things. So that's been something we've been seeing starting.
Really cool.
I sent mine in, but I got those cushions for your butt when you travel.
Oh, yeah.
Oh my gosh, I went out of town 2 weekends ago over to Salem or Portland, and the driving home, I was like, oh, I hurt so bad. I could barely get out of the car. So that's when I'm like, can I get these? And now I have it because I'll be traveling again the next couple weekends, and It's gonna be over 2 hours at a time. So I don't wanna stop every 20 minutes to stretch. So, and I have used it. Last weekend we traveled and it's a thinner cushion. Some people buy the same cushion, but for their office chair. It really helped a lot. I did not have any issues getting out of the car or my tailbone hurting. So it was worth it. Yeah.
I feel that because I felt that on the drive here. And
Yeah.
it just, it hurt.
If you get one, they're not
Yeah.
too expensive. They
Okay.
go through Cushion Lab. They have one for your seat and in your car if you're a traveling person. It's a life changer,
Okay,
actually,
yeah.
for traveling.
so great to
It
hear.
actually really is a good investment.
Yeah, especially when it provides that much relief.
Yeah,
Definitely.
and I was able to buy two. So I have
Mhm.
one for me and one for my passenger seat.
Oh, good.
Yeah, just in case anybody else in the car with me who's traveling needs it too. Yeah, it was really worth it.
Just last thing about Active and Fit Direct.
Sorry.
Oh, no, totally fine. I need to learn about that. If there's a gym that you are interested in and it's not an Active and Fit Direct's network, I can actually reach out to Active and Fit Direct and try and get them to reach out to that gym and see, there's a contract and things that have to happen, but we can see if that gym is willing to be a part of their network. So,
Veronica, I can tell you for sure, our Bend Metro Parks and Rec
okay.
is it's the one where people really want to go because they have multiple locations
Uh-huh.
and they have pools,
Oh, yeah.
which most of the other gyms don't have.
And that's
So
not a part, I guess I didn't see that one.
It
but-
isn't.
Okay.
It isn't, and I know that because somebody on Zoom, Raquel, had
Yeah.
mentioned that.
Okay.
So,
That would
yeah.
be nice. What is it called?
Bend Parks and Rec.
Oh, the Ben
Ben's
Park.
Park
Park and Rec. So
The city,
Juniper,
yeah.
Larkspur, and.
Oh, okay. I was thinking when
Yeah.
you said many locations, I was thinking they had it all over Oregon.
No,
Okay.
no, they just have, multiple locations here,
Here.
and, yeah.
Let me
here
write
in
that down.
Bend. But again, Redmond Parks and Rec, similar for folks who live in Redmond, they have a pool. And I know that's tougher to get them to sign a contract.
Yeah, they're more private.
Yeah.
Or
They do,
exclusive, I think, for the county.
other county fitness centers or Parks and Rec are a part of Active and Fit Direct, so
It's not
I'll reach out.
impossible.
I'll reach out and see. So Ben
Thank you.
Parks and Rec, yeah.
Yeah.
Mhm. Or Redmond or
Yeah, okay.
both of them, because I travel to Redmond if Ben Parks and Rec.
Yeah.
Recs wouldn't, and the other one would. It's not that far.
Okay, yeah, I'll reach out to my contact and see if I can reach out to them. Then we have Sprout at Work, which is MODA's new wellness platform. And it's designed to help build healthy habits. So you can log your steps on there. You can do different challenges on fitness challenges, mindset challenges, nutrition challenges. You can create your own challenge. You can also take a real-time health risk assessment. So it asks different questions about you and your health history, and you get a score. And then it can provide recommendations to improve your health risk score, and participating in different challenges and logging, your goals can help improve that health risk score. There's also social streams and communities that you can connect with and also encourage employees to attend. There's, like garden groups and, swimming groups. So you can be a part of those communities and connect with people who also like those activities. My favorite part is there's a content library that includes on-demand videos and then also articles on different health topics. And so for me, it's really fun I like to look at the on-demand videos. They have meditations, different style workouts, whether you like high intensity workouts, or maybe you're wanting like a yoga class or stretching. Really well quality videos, and that's what I really like about it. My favorite part is Sprout at Work. And you can enroll in Sprout through your member dashboard, and we also have more information on our wellness page on our MODA website. Then we have PREDI, which is MODA's pre-diabetes prevention program. And if you're wanting to find out if you can qualify for this program, you can take the CDC screening survey, is that what it's called? To see if you meet criteria to be a part of the program. And you get to work with a health coach, you get a Fitbit and also a scale. They also waive the copays to meet with a dietitian or a nutritionist. And we've had really, really great feedback from the first year of pre-D. People really like it. And so they're working on, there's group sessions that people really enjoy, I think more than we anticipated. And so they're looking, when people kind of graduate from the program, continuing to provide that group support since people have found it so beneficial. So really great. There's our website, and you can also email. I think the email is on the pre-D program at modahealth.com if you're wanting to find out more information. And then we have our telephonic health coaches. So eligible MODA members can work confidentially with a health coach to help set sustainable health goals, move towards those health goals, learning how to advocate for yourself and manage ongoing health issues. And since the health coaches, you meet with them either by phone or on video on the computer, they can meet with you just about anywhere. So if you're interested to see if you meet criteria to meet with a health coach, you can email or call. But I love our health coaches. We work really closely with them, and they're just really great, wonderful people who are wanting to provide support. So
we had one of our employees who called because they thought, oh, maybe it's just for physical health coaching, but they said, the coach said, no, what are you interested in? And the employee said, I just want to know how to age gracefully. And they are able to have a coach to help them work through some of that. So I thought that was really neat.
yeah, that's so great to hear. Our coaches are so wonderful. So I hope if you're interested in getting connected with the health coach, I hope you're able to do that. Then we have Weight Watchers Reimagined. And so this is as an OEB member, you have access to Weight Watchers. There's no cost for anyone enrolled in your OEB medical plan. So Weight Watchers Reimagined is a health habit tracker and a weight loss tool that combines nutrition, movement, and mental well-being. There are also meetups with WW coaches. They provide lots of resources in their app. And then there's also a diabetes program, a portion of WW, if that member meets criteria. And then some additional resources, if you're a non-MODA member, I found WebMD has a really great resource center with lots of information. Red Hot Mamas, that's a support group for people going through menopause, perimenopause, and menopause. And then there's also the North American Menopause Society, or NAMAS, and they have really great information on their site. And there's also a certification from NAMAS that practitioners and doctors can receive. And so they have a portal where you can look for doctors to see if they have that additional certification to make sure that they're able to assist you with kind of any menopause concern or question, because I think sometimes people, not all doctors are the same, of course, but some people might need a little bit more support regarding their menopause symptoms, and finding a doctor that has that certification might be really helpful. So I highlighted that website. And then the last, if you're just interested in more healthy habits, we had some recordings, some past webinars, and you can also find out our future webinars when those occur, and then workshops that are done by, I know we're almost right at time, by us and our health coaches create a workshop every day on a different once a month on a different health topic. And so those are also on our website, available to MODA and non-MODA members. And
Okay, Veronica, really quick. So
Oh, yeah.
we're right at time here.
Yeah.
I would like to say thank you to folks.
Okay.
Thank you to you. And I'm gonna stop the recording
Okay.
now.